Hi, I'm Lisa Chase,
I'm Dr. K.
and we're here to chat with you a little bit about visceral manipulation. So Kirsten is a specialist in visceral manipulation, and I have seen some amazing changes in my patients, and I wanted just to kind of talk to you a little bit about how that impacts somebody's recovery when they're in physical therapy. So say, for example, like you and I co-treated somebody the other day who had a ski accident, right?
Yep.
And we were working on the shoulder.
Yes.
And in that trauma, you had identified that something happened to the liver. So talk a little bit about how the organs play a role and how they can get injured and how they can affect things like the shoulder, where you think it's a musculoskeletal problem, but it may actually be tied into what's happening in the organ.
Mm-hmm. So in our nervous system, our spinal nerves that come out of our spinal cord do not just go to our muscles and the joints. They also have, on the same nerve, they also go to an organ, a specific organ. And they give feedback to the brain and tell you kind of where you are in space. So with this gentleman, he had had a ski accident. He fell, he landed on his shoulder, and at the same time, he must have in some way shifted kind of where his organs took part of that trauma, right? Your fascial net in your body is throughout your body, holds up your organs, is through your muscles. It's all one continuous network. So he had a limitation in his range of motion. He did have some joint problems within the actual shoulder joints themselves. But those organs that refer to that area that are on the same nerve segment were also giving some feedback, telling his body, hey, I have an issue here. So he was limited in his range of motion, as well as some pain and limitations like that. So if you look at a person with trauma, let's say in a car accident,
Yeah.
they'll have a seat belt coming across like so.
Yeah.
It comes across like so. When they get into an accident, they can get in that motion there, and that can affect both the rib cage as well as the lung, as well as the esophagus, the liver, the stomach, all those things. So any of those things can take some of the forces that happen within a car accident. And the visceral work can, in coordination with the musculoskeletal work that we do, can help to kind of get the body back to better balance and homeostasis as the patient is strengthening and getting back to normal function.
Yeah, and that's one of the things I love about Back to Normal is that we have different specialists, right? So we collaborate so well that, really we expect within a couple sessions our patients to be getting better. And if we need another specialty, like you do visceral and pelvic floor and, the cranial.
Yeah.
And so it's great to be able to pull you in and consult on those cases. So that was great. Thanks for sharing that.